The Trouble with Pollen, written by Dr. William E. Berger, author of Allergies and Asthma for Dummies. Pollen is everywhere. These tiny grains from trees, grasses, and weeds float in the air. Most people don't even notice them, but for some, pollen causes big problems. This is called pollen allergy. It's also known as hay fever or allergic rhinitis. Pollen allergy is very common. It affects millions of people. It can make you feel miserable. But the good news is that it can be managed. With the right information and treatment, you can find relief. This essay will help you understand pollen allergy. We will discuss its symptoms, causes, and treatments. We will also look at how to prevent and manage this allergy. By the end, you will be equipped to handle pollen season with confidence. Pollen allergy affects the nose, eyes, and throat. It happens when your body overreacts to pollen. It sees pollen as a threat, even though it's harmless. This triggers a chain reaction leading to uncomfortable symptoms. One of the most common symptoms is sneezing. You might find yourself sneezing uncontrollably, especially in the morning. This is your body's way of trying to expel the pollen. Along with sneezing, you might experience a runny nose. Your nose might feel stuffy or congested. Another telltale sign is itchy and watery eyes. Pollen can irritate the eyes, making them red and puffy. You might also feel an itchy sensation in your throat, nose, and ears. If you experience these symptoms during pollen season, you are likely dealing with a pollen allergy. Pollen is essentially plant sperm. It is a fine powder that plants release to fertilize other plants. While invisible to the naked eye, pollen grains are incredibly small and light. This allows them to travel long distances in the wind. Different plants release pollen at different times of the year. Trees typically pollinate in the spring, grasses in the summer, and weeds in the fall. The amount of pollen in the air can vary depending on the weather. Warm, dry, and windy days tend to have higher pollen counts. When these pollen grains come into contact with the lining of your nose, eyes, or throat, your immune system kicks into action. For people with pollen allergies, their immune system mistakenly identifies pollen as a dangerous invader. This triggers a cascade of reactions, leading to the release of histamine and other chemicals. These chemicals are responsible for the uncomfortable symptoms of an allergic reaction. Imagine your immune system as a security system. Its job is to protect your body from harmful invaders like viruses and bacteria. When a foreign substance, like pollen, enters your body, your immune system springs into action. In people with allergies, the immune system overreacts to harmless substances like pollen. It mistakes them for dangerous invaders and launches an unnecessary attack. This is where the trouble begins. When you have a pollen allergy, your body produces antibodies called immunoglobulin E, or IgE. These antibodies are specific to the type of pollen you are allergic to. When you encounter that pollen again, the IgE antibodies bind to it and trigger the release of histamine from mast cells. Histamine is a chemical that causes inflammation and is responsible for many of the symptoms of an allergic reaction. Section 5. A Day in the Life: How Pollen Allergy Impacts Daily Activities. Pollen allergy can significantly impact your daily life, making everyday activities a challenge. Imagine waking up with a stuffy nose, itchy eyes, and a persistent cough. It's hard to feel motivated and productive when you're battling these uncomfortable symptoms. Going to work or school can feel unbearable. Concentrating on tasks becomes difficult when you're constantly sneezing, blowing your nose, and rubbing your itchy eyes. You might find yourself feeling fatigued and sluggish due to poor sleep quality and the constant struggle to breathe clearly. Social events and outdoor activities lose their appeal when you're worried about pollen exposure. You might avoid parks, gardens, and other outdoor spaces to prevent triggering your allergies. This can lead to feelings of isolation and frustration. Section 6. Beyond the sniffles: the potential complications of untreated allergies. While pollen allergies are often perceived as a minor annoyance, untreated allergies can lead to more serious complications. It's crucial to understand that allergies can worsen over time and impact your overall health. One significant concern is the development of asthma. Untreated allergic rhinitis, the medical term for hay fever, can increase your risk of developing asthma or worsen existing asthma symptoms. Asthma is a chronic respiratory condition that causes inflammation and narrowing of the airways, making it difficult to breathe. Another complication is the increased susceptibility to sinus infections. When your nasal passages are inflamed due to allergies, it creates a breeding ground for bacteria and viruses. This can lead to recurrent sinus infections, which can be painful and debilitating. Section 7. Finding relief over-the-counter solutions for pollen allergy. Fortunately, there are many effective treatments available to manage pollen allergy symptoms. Over-the-counter, or OTC, medications can provide significant relief, allowing you to enjoy your daily life without constant discomfort. Antihistamines are a popular choice for allergy sufferers. They work by blocking the action of histamine, the chemical responsible for many allergy symptoms. Popular antihistamines include cetirizine, known as Zyrtec, loratadine, known as Claritin, and fexofenadine, known as Allegra. These medications come in various forms, such as tablets, capsules, and liquids. Nasal corticosteroids are another effective option. These nasal sprays help reduce inflammation in the nasal passages, providing relief from congestion, sneezing, and runny nose. Popular nasal corticosteroids include fluticasone, known by brands like Flonase and Veramist, mometasone, known as Nasonex, and cyclosinide, known as Omneris. Section 8. Prescription Power. Seeking medical help for severe allergies. If over-the-counter medications don't provide adequate relief, it's essential to consult a healthcare professional. They can assess your symptoms, determine the severity of your allergies, and recommend appropriate treatment options. For severe allergies, your doctor might prescribe stronger medications, such as prescription-strength antihistamines or nasal corticosteroids. They might also recommend leukotriene modifiers, such as montelukast, which block the action of leukotrienes, chemicals that contribute to inflammation. In some cases, your doctor might refer you to an allergist, a specialist who diagnoses and treats allergies and asthma. An allergist can perform allergy testing to identify the specific pollens you are allergic to. This information can help tailor your treatment plan and provide valuable insights into managing your allergies effectively. Section 9. Minimizing exposure. Practical tips for avoiding pollen. While it's impossible to completely avoid pollen, there are practical steps you can take to minimize your exposure and reduce your allergy symptoms. By being proactive and making simple adjustments to your routine, you can significantly improve your quality of life during pollen season. One crucial tip is to monitor pollen counts. Many weather apps and websites provide daily pollen forecasts. By checking the pollen count, you can plan your outdoor activities accordingly. Avoid going outside during peak pollen times, typically early morning and late afternoon. When you do venture outdoors, wear sunglasses to protect your eyes from pollen. Consider wearing a hat to prevent pollen from settling on your hair, which can transfer to your pillowcase at night. Upon returning home, change your clothes and wash your hair to remove any lingering pollen. Section 10. Long-term strategies. Allergy shots and building tolerance. For long-term relief from pollen allergies, your allergist might recommend allergy immunotherapy, commonly known as allergy shots. This treatment involves receiving regular injections of small amounts of the allergen, in this case, pollen, over a period of time. The goal of allergy shots is to gradually desensitize your immune system to the allergen. By exposing your body to increasing doses of pollen, your immune system learns to tolerate it, reducing the severity of your allergic reactions. Allergy shots are typically administered once or twice a week initially, gradually decreasing in frequency over time. The entire treatment course usually lasts 3 to 5 years. While allergy shots can be highly effective, they require commitment and patience. Section 11. A breath of fresh air. Living well with pollen allergies. Living with pollen allergies can be challenging, but it doesn't have to control your life. By understanding your triggers, taking preventive measures, and seeking appropriate treatment, you can manage your allergies effectively and enjoy a full and active life. Remember to be proactive about your health. Monitor pollen counts, minimize your exposure, and keep your medication on hand. If your symptoms are severe or interfere with your daily life, don't hesitate to consult a healthcare professional. With the right knowledge and tools, you can breathe easier and embrace the beauty of the outdoors without fear of debilitating allergy symptoms. Pollen allergies are manageable, and with the right approach, you can live a happy and fulfilling life even during pollen season.